In 2035, science announced that, in certain countries, the first batch of people who can live to 150 has quietly emerged.
At the same time, an unprecedented event happened in a hospital. A person was deemed unworthy of resuscitation. It was not a doctor's mistake, nor a shortage of equipment. It was an AI ruling.
Based on survival probability, social contribution, and future medical consumption, the algorithm concluded resuscitation is not recommended.
2035 is a world where lifespan is rewritten by AI and healthcare is reshaped by AI.
Think about it. Will you be the chosen one marked 150 years old? Or the life rejected by the algorithm for resuscitation?
In 2035, the global scientific community was jolted awake by a simultaneous update. Websites of Nature and Science boasted a batch of papers with nearly identical titles. AI-assisted longevity optimization.
These papers exceeded 1 million downloads into hours, for they reached a conclusion that could upend 0 years of human fear. Death is no longer an absolute fate, but a system vulnerability that can be identified, repaired, and even delayed by AI.
23 top teams including Stanford, Harvard, and MIT conducted a 20-year longitudinal study covering real samples from 32 countries, and built an unprecedented scientific model with 310 million pieces of human physiological tracking data.
They announced that human lifespan is entering an era written not by God, but by algorithms. What AI can do far exceeds your imagination of medicine.
It seamlessly connects to your smart bracelet and subcutaneous sensors. And just like weather forecasting, it can pinpoint the exact month your lung function will start to decline 10 years in advance. Identify the specific day your kidney filtration rate will drop 200 days ahead, and even calculate the year-end week each of your hairs will turn white.
This is predicting life. On a deeper level, it is AI's predicting death.
It accesses 300 million clinical cases, 12 million gene sequences, and 14 PB of physiological databases worldwide, simulating cancer cells spread routes in 0.02 seconds with an error rate as low as 0.1% more accurate than the most senior oncologist. For the first time, AI turned death into a quantifiable, modelable, and countdownable event.
But what's truly terrifying is the virtual organ trial.
Before you swallow a pill, AI has already run tens of thousands of drug simulations on a 1:1 digital twin, predicting all metabolic pathways, eliminating allergic reactions, and avoiding side effects.
For the first time in medical history before taking medicine, your body has lived 10,000 times in algorithms.
Nanorobots have disassembled aging itself. Blood robots with a diameter of only 50 nanometers cruise in your body 20-7, clearing beta-amyloid proteins, repairing microvascular tears, and maintaining cellular homeostasis.
This is not delaying aging, it is repairing aging. The world of surgery has also been completely written by AI.
For decades, the failure rate of minimally invasive surgery hovered around 7%. But after AI took control of robotic arms, this number dropped to 0.01%, meaning only 1 accident per 10 surgeries. Doctors have for the first time transformed from decision-makers to reviewers, responsible for checking AI's answers instead of making their own judgments.
When OpenAI's one model achieved a 78.3% diagnostic accuracy rate in emergency care, far exceeding the human average of 56%, the medical community realized one thing: AI is no longer a tool, but a judge holding the power of life and death.
These numbers don't lie following antibiotics and vaccines. Humanity ushered in the third lifespan revolution. But on the very day medicine shifted from probability to algorithm, a new kind of anxiety began to spread.
For the first time, you can clearly see your own ending day. I knows when you will die better than you do. This certainty itself is more suffocating than death. In 2035, hospitals are no longer classified by departments. In their place is a lifespan grading system that no one can escape.
A 3- high electronic screen at the entrance displays only 2 lines of text. Gold on the left 150- year, -old candidate channel. Gray -blue on the right basic life support zone. Every day at 4 a.m. The system automatically updates your lifespan score, accurate too for decimal places. It determines whether you can queue, use equipment, or even be worthy of resuscitation.
This is not a suggestion, it is a verdict.
What no one dares to say is that the error rate of life score rating data for low-minus income groups is as high as 19%, yet it is packaged as science. Zhang Lan, an internal medicine doctor, has been suffering from insomnia for 32 consecutive days. It's not because of patients, but because of the doctor's AI compliance assessment system. The 2035 diagnosis and treatment process has only 3 steps. AI evaluates lifespan value. AI generates the optimal plan. Doctor presses confirm and execute. Doctors no longer make decisions. They only take charge of compliance. Last week, she prescribed a 300-U on monthly generic antihypertensive for Grandpa Yu, and the next second, the entire screen turned bright red.
Deviation from AI plan by 12.4%, triggered doctor rating downgraded from B to C. Performance reduced by 30%. 3 consecutive violations, suspension of practice. Zhang Lan hastily entered an explanation. He can't afford targeted drugs. He lives on subsistence allowances.
The AI coldly interrupted, "Please stop providing emotional reasons. AI healthcare does not consider payment capacity. Insisting on manual decision making will trigger an ethical investigation."
An I- catching small text popped up in the bottom right corner. Doctors' subjective judgments are the biggest risk to lifespan optimization. Zhang Lan knew she was not practicing medicine. She was being monitored.
The lifespan dashboard. You can't delete it or turn it off. Everyone must use it. Every day. It sends the same announcements to 1.4 billion people. Insufficient deep sleep. Lifespan reduced by 0.18 years. Inflammation index increased by 0.03%. Lifespan potential deducted by 0.2 points. Predicted lifespan 97 years. 11 years less than peers. Recommended to purchase accelerated repair package 12,800 to restore lifespan points.
For the first time, health has become a game of constant point deductions, and all bonus items cost money. Medicine in 2035 no longer treats diseases. It conducts lifespan resource redistribution.
A prominent AI lifespan stratification table is posted on the hospital wall. A145 150 years. A130 145 years. B110 130 years. C85 100 years. D treatment not recommended. Quarrels, cries, and AI broadcasts intertwine into a daily noise competition.
The broadcast suddenly sounded resource shortage detected. Grade B users will be delayed by 8 hours. Grade A users will enter treatment immediately.
28-year-old programmer Chen Feng rushed to the nurse's station and shouted, "Same illness. He gets 40 more years of life while I can only take medicine?" Just because he can afford a 120 on annual longevity package. Does life have VIP tiers too?
The prompt screen coldly responded, "Gold minus tier, user waiting time 3 minutes. Regular user waiting time 17 days.
On the other side of the corridor, 82-year-old Grandpa Wang's hands trembled. His lifespan score was grade C. The report was as precise as a financial statement. Estimated lifespan extension of 5.2 years. Does not meet the surgical input minus output ratio threshold below 37%.
The AI continued broadcasting. If treatment is insisted upon, please prepare 148,600 yuan. Insufficient medical insurance balance will result in automatic withdrawal from the treatment queue.
His son sat on the floor, sobbing to the point of suffocation. Waited 7 days. Why did we even lose the right to resuscitation?
The longevity VIP floor on the 18th floor was a completely different scene. Fully transparent oxygen chambers, cell anti-aging rooms, gene stability access control, and full air filtration every 12 hours.
The golden words on the wall glowed like a mockery. Longevity is not a right, but an asset.
Meanwhile, the air treatment efficiency in the basic zone downstairs was 37% lower, and the queue could take up to 38 days. After I took over hospitals, medicine has transformed from saving lives to resource management. Disease was never the problem. Value-wise, health is no longer a right. Longevity has become capital. Doctors no longer save you. Algorithms judge whether you are worthy of being saved.
In 2035, humanity realized for the first time that the scarcest resource in the future is not medicine or equipment, but lives deemed worthy of extension by AI.
Your life is both more expensive and cheaper than others.
Third high for -year-old programmer, VZHE received his annual AI-depth physical examination report. No comfort. No advice, only a final verdict. 97.3% probability of heart failure in 9.4 years. Myocardial cell activity is 23% lower than peers. The inflammation dynamic curve is in continuous decline. The risk curve is almost touching the death line.
His hands trembled so much he couldn't hold the mouse. AI doesn't tell you that you might get sick. It tells you how you will die.
Another price list popped up: biotherapy intervention 23. 0 yuan per session, 12 sessions. Gene sequence nutrition plan 8. 0 yuan per month. 24 hours heart monitoring subscription 36. 0 yuan per year. Cell activity training chamber 1. 500 yuan per session. Total for 1 year 180. 0 yuan.
For someone with a monthly salary of 20. 0 yuan and only 0 yuan left after rent. This is not a treatment plan. It is a stay of execution.
He tried to apply for a longevity loan. The customer service coldly read the terms. Your lifespan score is 72 points. Does not meet the 80- point loan standard. Sorry. You do not have longevity credit eligibility.
This sentence was crueler than the physical exam report. You are not worthy of life extension. At that moment, he realized that longevity in 2035 was never a medical act, but a series of algorithm-driven value judgments.
Ordinary people can't live to 150, not because they're incapable, but because the system has calculated that their income, assets, and professional contributions are insufficient to justify occupying medical resources.
Longevity is not a right, but a privilege. At the other extreme was 88-year-old academician Jia Jianluo. He was in good health and wanted to retire to take care of his grandson, but received a system notification.
Longevity value score A. Does not meet retirement criteria. Recommended to continue undertaking national strategic scientific research tasks.
Retirement? It was no longer his choice. To maintain the optimal brain state required by the research institute,
he had to undergo anti-aging treatment. Once a month gene editing to improve liver function by 21.3%. 70% inhibition of neurogenerational. And metabolic reset to 45-year-old levels.
His body was maintained as a national resource. Like a precision, if any indicators drop, the system would automatically alert.
Once he refused treatment due to a cold. The next day, an AI health specialist visited and said you have been included in lifespan strategic resource management. Discontinuing treatment, affecting national project stability. Consequences at your own risk.
An 88-year-old man couldn't even rest when sick without reporting to the system.
He sighed as he looked at his little grandson outside the window. The world once regarded longevity as a gift. But in 2035, it had become another form of forced labor. You are not living longer. You are being required to live longer.
For Li Xiejie, life was deemed unworthy of extension by the system. For academician Xiao, life was forced to be extended to the point of no withdrawal allowed. This is the 2035 reality. The poor died early, and the valuable lived too long.
Medicine was no longer about the body. It was about who was worthy of being alive.
Society in 2035 no longer divided people by wealth, but by a more straightforward metric: whether they could live to 150.
AI had turned lifespan into a quantifiable, optimizable, and tradable system. The first iron rule of the system was not everyone was worthy of longevity.
In upper-class society, 150 years old was just the default setting. They underwent quarterly organ micro-updates, annual gene repairs, and downtime-aging strategy overhauls every decade. They could even have AI design a complete biological rhythm roadmap for the next 10 years to keep cellular aging at an ideal rate.
The CEO of a tech giant openly stated in an interview, "My biological age will stay at 45 forever." This is the most reasonable resource allocation for high contributors.
Here, longevity was not a luxury, but part of the job. For the general population, they could never catch up to the lifespan curve.
Most people faced a completely different world. Every day, AI sent them lifespan warnings. Your health fluctuations deviate from the standard trajectory. Recommended to subscribe to the basic longevity package to maintain lifespan potential. Your current state does not have 150-year-old potential.
It sounded like a reminder, but it was more like an unavoidable mental tax. The reality was that they couldn't even afford the most basic longevity treatments. So called universal 150-year lifespan was just a number in reports, not a reality for their bodies.
Workplace competition was also completely rewritten by lifespan scores. New graduate Lin Miao heard the same rejection reason repeatedly. Your biological age score is 78. We only hire candidates with scores above 85 to ensure job stability.
The bottom line of job requirements became able to guarantee work until 80 years old. Young people realized for the first time that employability was not determined by education or skills, but by how slowly they aged.
The previous generation maintained 40-year old brain performance and healthy adult reaction speed under AI maintenance. They felt no fatigue, no decline, no illness, and thus were not allowed to leave their positions.
With positions not becoming vacant, young people were forever waiting for the next longevity quota update. This is an intergenerational and unsolvable competition.
Systemic anxiety seeped into every corner. Insurance rates fluctuated with biological age of 5% increase per year. Mortgage terms could be extended to 90 years, meaning repayment until the end of life. And credit card limits were tied to lifespan scores.
Those with low scores didn't even qualify for debt. Living was becoming an expensive subscription service. Every night, someone was woken up by AI.
Stress indexes to high. Please adjust immediately. You have failed to meet longevity goals for 3 consecutive weeks. Biological age has not decreased, which will affect future workplace competitiveness. They stared blankly at their phones, watching their lifespan scores flicker like stocks as if life was not growing, but being audited.
The real dividing line in the future was not wealth, but who was allowed by the system to live longer. Ordinary people were paying for survival. 150 years old was not a victory of civilization, but the true starting point of humanity's entry into the era of algorithmic rule, extending human lifespan by 70 years in human eyes. It was a technological miracle. In the AI system, it was an algorithmic formula triggering social collapse.
AI's precise predictions were ruthless. Social labor hours would increase by 3.2 times. Employment supply-demand imbalance would surge by 180%. Annual medical resource consumption would rise by 87%. And the pension system deficit would expand to 120 trillion yuan.
Longevity did not solve problems. It prolonged, intensified, and amplified them.
AI completely reshaped the healthcare system. Doctors were no longer decision-makers, but monitors executing algorithmic instructions. Hospitals allocated equipment and surgical resources by lifespan grade, prioritizing high-return patients while automatically delaying or rejecting treatment for low-scoring patients.
All medical plans were generated by AI, with risks and benefits quantified to 4 decimal places. Patient payment capacity and subjective wishes were almost irrelevant. Medicine had broken natural boundaries, but social structures and resource-carrying capacities had not.
A 23rd for study by the School of Life Sciences at the University of Electronic Science and Technology stated that under global constraints of arable land, energy, and ecological carrying capacity, the sustainable human lifespan was approximately 110 years. The so-called 150-year revolution was just an illusion created by tech giants. Death had not disappeared. It had been transformed into installment, plan anxiety. Longevity was not universal. It was algorithms deciding who was worthy to live and who should be delayed.
For the first time, the value of life was defined by cold numbers, not humanity or ethics.
AI completely transformed healthcare from treating unsaving lives to resource optimization and longevity asset management. High-value groups received round-the clock monitoring and intervention, while low-value groups were restricted from using high-end equipment, drugs, and treatments. Health was no longer a right, but a resource that could be bought, evaluated, and stripped away.
AI decides how long you can live and how much your lifespan can be extended today. Will it decide whether you can survive? Be free, or even exist tomorrow?
Longevity technology was not at dawn, but the first test paper for AI's comprehensive reshaping of life and society. This was the first time humanity faced the truth. Algorithms not only defined life and death, but also reshaped healthcare, labor, social classes, and existence itself.
In 2036, the AI Fabulist will take you into a more dangerous field than healthcare the day the judicial system is fully taken over by AGI.
Predictive crime becomes the norm. AI can determine your criminal tendency before you act. Legal provisions are converted into lines of code, and AI algorithm rulings are more authoritative than human judges. Freedom is quantified, monitored, and priced. How much autonomy can humanity retain?
In the 150-year-old era, we lost the boundaries of lifespan. In the AI Judge era, we will lose the boundaries of freedom. The basic rights of being human. The AI Fabulist episode for AI Judges the 2036 judicial system crisis. Will be launched on time next week. Click the reservation button below to unlock the judicial truth under AI rule. And enjoy exclusive behind the minus scenes analysis.